Hello, YouTubers. Welcome to my channel, Lady Nephrology, where we talk all things nephrology. If you know any ladies in particular or anyone living with chronic kidney disease, end-stage renal disease, or kidney transplant, please refer them to my channel. Please make sure you like, subscribe, and leave any comments below. So on today's episode, we will be talking about high blood pressure and chronic kidney disease. High blood pressure, hypertension, and kidney disease. So what is high blood pressure or hypertension? Hypertension is a condition in which the force of the blood against the artery walls is too high. And high blood pressure is also known as the silent killer because a lot of people are asymptomatic, they don't have any symptoms, and they can walk around for years and not know that they have high blood pressure. And then it's under the scenes doing the dirty work, messing up the kidneys, messing up your blood vessels, and all kind of things that high blood pressure does, but a lot of times you don't feel it until it's too late. So that's why it's known as the silent killer. Nearly half of the adults in the United States have high blood pressure. According to the CDC, in 2013, greater than 36,000 cases in the US listed high blood pressure as a primary or contributing cause of death. And the prevalence of high blood pressure also increases with age. So high blood pressure or hypertension as it relates to kidney disease. There is a high prevalence of high blood pressure among patients with chronic kidney disease and end-stage renal disease. Hypertension is both a cause and a consequence of CKD. Treatment of hypertension is associated with improved cardiovascular outcomes in both the chronic kidney disease population and ESRD, which is the end-stage renal disease population. 70 to 80% of hemodialysis patients do have high blood pressure. And lowering the blood pressure can help slow down the eGFR, which is the estimated glomerular filtration rate. So it can slow down the eGFR decline, it can delay progression to the end-stage renal disease and reduce the incidence of cardiovascular disease in patients with chronic kidney disease. So lowering that blood pressure is very important. So some of the high blood pressure categories, the normal blood pressure is less than 120, which is the top number, systolic number, over 80. And 80 is the bottom number, which we call diastolic. So normal blood pressure is less than 120 over 80. Elevated blood pressure, the systolic blood pressure is usually between 120 and 129. That's considered elevated. And the diastolic, less than 80. And some of the categories here, we have stage 1 hypertension here, when you have the systolic blood pressure, which is 130 to 139, that's considered stage 1 hypertension, and the diastolic blood pressure between 80 and 89, that's stage 1. Then you come here down to stage 2. You have the systolic blood pressure is greater than 140, top number, that's considered stage 2, and the diastolic blood pressure greater than 90 is considered stage 2 high blood pressure. And then when you're in a hypertension crisis, the systolic blood pressure is greater than 180, and then the diastolic is greater than 120. So these are some of the categories. So what most people want the normal blood pressure, which should be less than 120 over 80. Some factors leading to inaccurate blood pressure readings for dialysis patients, and sometimes patients in general, the white coat effect. A lot of patients, whether they're dialysis patients, CKD patients, have the white coat effect. You go to the doctor's office, you're nervous, you don't know what's going on, you see somebody in a white jacket, your blood pressure rises. And also with dialysis patients, limited time for relaxation because they're coming into the clinic, we're hurrying to taking the blood pressure to get them on the machine quickly. And also any other patient going to a doctor's office, you want to make sure that they're able to have a time to relax and have their feet sitting up with their feet on the floor for at least 5 minutes before you take the blood pressure. With dialysis patients, there's also that fear or anxiety of the AV fistula or AV graft needling. So when dialysis patients, we do have to use needles to access their fistula or graft for dialysis, and some patients are scared of needles, so that can also lead to a rise and increase in the blood pressure. So the target blood pressure goes for CKD, which is chronic kidney disease, and ESRD is end-stage renal disease patients. So the target goes for these patients per KDOQI guidelines, these are kidney guidelines, 2021. If you have stage 3 to 5 chronic kidney disease without Protein, our urinary is protein. Blood pressure goal is less than 120/80. So if you have stage 3 to 5 chronic kidney disease without protein, you want your blood pressure to be less than 120/80. If you have stage 1 through 5 chronic kidney disease with protein in the urine, you want that goal to be less than 120/80. Kidney transplant recipients, the target blood pressure goal should be less than 120/80. The kidney transplant recipient's target blood pressure goal should be less than 130/80. So if you have a kidney transplant, less than 130/80 is the goal. In stage renal disease patients on hemodialysis, so when you first come into dialysis, pre-dialysis, you want that blood pressure to be less than 140/90. And post-dialysis, once you're leaving dialysis, after your treatment's over, you want the goal blood pressure to be less than 130/80. So the first line treatment of high blood pressure. First line treatment, we like to do lifestyle modifications. So that includes a sodium intake of less than 2 grams a day. And I know it's very hard because if you have any type of canned foods, and so many foods today or have so much sodium, so it's very hard to do less than 2 grams a day, but that is the goal. You want to do moderate intensity physical activity for at least 150 minutes per week or more. Weight loss for those people who are overweight or obese, it really helps to lower the blood pressure, reducing alcohol consumption, and adopting a heart healthy diet. Those are all lifestyle modifications, and we like to use that for the first line treatment of hypertension. And some pharmacotherapy, which is some medications that we start people off with, diuretics. We use in patients who have residual kidney function, which that means people who still produce urine. So if you don't produce any urine, we do not want to put you in a diuretic. And so if you have a GFR, which is the glomerular filtration rate of greater than 30, so if your kidney function is functioning greater than 30%, thiazide diuretics such as hydrochlorothiazide can be used. And when the kidney disease starts to decline and the glomerular filtration rate gets less than 30 mils per minute, then that's when we switch over to the loop diuretics such as Lasix, furosemide. Those are more potent, and then they help more once that kidney function starts to decline. And then we also use ACE inhibitors, example lisinopril or an ARB, example losartan, and those medications are good to use, especially for diabetic patients and patients with that protein in the urine. Those medications are really effective. And other agents is indicated for blood pressure: calcium channel blockers, beta blockers, vasodilators, and then there's also other agents that are used to treat high blood pressure. So in summary, the management of high blood pressure is different for the chronic kidney disease and dialysis patients. And really with dialysis patients, fluid management is key. Making sure you're removing that fluid off is very, very important to get that fluid off and to get them to their dry weight to help manage that blood pressure. And sometimes we get patients to their dry weight, and a lot of times people can come off some of those high blood pressure medications. So really with dialysis patients, that is our really goal, is to find that dry weight and get all that extra fluid off. So we want to make sure that patients are eating a heart healthy diet, which is low in sodium, getting our regular exercise in, maintaining a healthy weight, and to take your blood pressure medications as prescribed by your doctor, and make sure you follow regularly with your physician to make sure the medication is effective, and make sure you check your blood pressure at home and take a blood pressure log, and all those things really help to manage high blood pressure. So that's the summary of high blood pressure and kidney disease. And thank you guys for tuning in. And like I said, please like, subscribe, and leave any comments below or any suggestions. We would really be appreciated. And thank you guys so much, and have a good day. See you later.